from BSN-9 and this is the donning and doffing of PPE.
Putting on PPE should be done outside of the patient's room, ideally in a dedicated area or with the supervision of a colleague. There are different types of PPE that varies according to the risk assessment and procedure to be followed to correctly protect oneself. To start, ensure that you've removed all your jewelries and that your hair is tied back. Always be aware of the risk involved in the care you are to provide to your patient. Step 1 is to perform hand hygiene by using an alcohol-based solution. Apply the product into a cupped hand, then rub hands together, palm to palm. Rub back of each hand with your fingers interlaced. Then, rub them palm to palm with interlaced fingers. Next is to rub the back of your fingers to opposing palms. Proceed to rotationally rub thumb with opposing hand. Lastly, rub your fingertips rotationally on the opposing hand's palm. Continue till your hands are dry. Let's move on to the actual donning of PPE. Check the integrity of your PPE. Make sure there's no damage. Put it on and secure it by tying it around your neck and waist. Next, wear your medical or surgical mask. Make sure it covers both your nose and mouth. Try to not touch the mask once it's on. If it's necessary, perform hand hygiene before and after touching the mask. Put on your eye protection. The one I'm putting on is not medically graded. Next is to put on a pair of gloves. Ensure that it's placed over the cuff of your gown. After that, for one last time, ensure each piece you have on you is placed on correctly. You are now ready to enter the patient's room. After your procedure, you should now remove your PPE. Be reminded that doffing of PPE poses the highest risk of transmission to healthcare workers. Follow the correct order in doffing the PPE. Do it in front of a colleague or a mirror. First step is to remove the gloves. This is the most soiled piece, which is why it's removed first. Next, remove the gown by untying the ties and make sure the gown is pulled away from your body. Turn the gown from inside out and dispose it safely. Perform hand hygiene by a hand rub for 20 to 30 seconds before touching your face for eye protection removal. Then, lean forward and pull eye protection from face. Remove mask or respirator by pulling it by their straps and dispose it properly. Perform your last hand hygiene by hand rub or with soap and water if they're visibly soiled.